All right, everybody. Next, let's talk about how to address some tenderness that occurs on the plantar aspect of the midfoot, and as well as restoring plantar flexion to the midfoot. So I'll show you a couple strain counter training techniques combined with a muscle energy technique, and then possibly an exercise afterwards. So here you are. You can go into a kneeling position like this. With a finger, you might be able to identify a point in the midfoot that is tender, in which case that might be your target point, all right? You would cup your hand like this around your heel, like so, and so you try to aim the cup towards that point, all right? So if it's this point right there, I'm going to just direct, let's see, if it's this point here marked by my finger, then I'm going to direct my hand down across that, and you can just sort of kneel back into it to go right at the point of tenderness. You might need to do a little bit of fine tuning by rolling your ankle in or out so that you can get right at that particular spot. I'm applying a fair amount of force to the posterior, not the inferior, but the posterior aspect of the heel to pull the heel down and towards that point, like this. All right. So here's my spot. I'm going to move my heel down and towards that spot, shortening all the tissues at that point, and we'll hang out like that. Usually, after I've done this for my minute, say, heading towards 90 seconds. Now, if you just dorsiflex the toes into the table and then relax, you will get just a little bit more motion at that midfoot joint, at the midfoot joints, which will give you a little bit more plantar flexion at the midfoot. The follow-up would be what I call a Japanese tea ceremony stretch, which would just be sitting on your heels. From the other side, it would look like this. So my spot that I'm trying to aim at, I'm going to take my hand, cup it around the posterior, not inferior, but posterior part of the heel, to kind of turn the heel down and in to the point that is tender until it is no longer tender. And then I can dorsiflex my toes into the table for contract, relax, produce a little bit more plantar flexion at the midfoot, which remember would be like raising your arch. And then relax, and now Japanese tea ceremony. Eventually, I like to follow this exercise up with resisted seated heel raises, maybe with airband around the chair, and that should really help your patient restore that plantar flexion or arch to their midfoot.